Cardiac disease is often hereditary, and it's estimated that up to 10,000 young people in Ireland are at risk. Preventing these needless tragedies centres around educating young people and their families about the risk and accurate diagnosis. And behind me in Tallaght Hospital is the centre, which is entirely funded by CRYP, which has assessed more than 1,500 people a year since it was set up. Dr. Deirdre Ward has been testing patients here since the centre opened. What exactly are you testing for?
We're testing for inherited heart conditions. So one of the main causes of sudden death in a young person who dies of sudden cardiac death is a genetic condition which may be inherited. So if somebody in the family has died, other people in the family potentially have a 1 in 2 chance of having the same condition. There's a sort of a basic factor test that pick up most things. So the simplest one is a resting ECG, which is a recording of the electrical activity in the heart. Then we usually do this ultrasound test, which is to look at the heart's structure. This takes about 20 minutes from start to finish, and then we would usually do a treadmill test as well.
I suppose coming in here, you can be given the satisfaction of knowing that everything's going to be okay.
Yeah, as soon as you take out the treadmill, you go into the office and they tell you exactly what you need to know.
Well, I was working with Michael back in 1996, prior to CRYP existing, when his son Peter died, and Michael and Mary went on to set up the charity, and I was basically doing the typing and the admin work for him. My own niece then came to work with Michael that summer, got to know him, and then subsequently she died. So Jenny died, and that's when I suppose it really became personal for me.
Consultant cardiologist Dr. David Mulcahy helped to set up the CRYP Centre. I suppose you felt that there was a need to do it. Is that because there was nothing like it at that time?
There was nothing. There was nothing. I remember when we moved out to Tallaght, for some reason or another, I set up an adolescent cardiology clinic, of which there were none in the country. And as part of that, I started getting the odd referral of young people who would have lost a sibling or a family member. And I found that I was seeing groups of 3 or 4 family members in my office at 7 or 8 at night with no proper structures and no way of dealing, never mind the medical issues, dealing with the shocking emotional effects of sudden death.